Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. I'm joined with a wonderful guest from my home state, North Carolina, Jessica. Jessica, please introduce yourself.
Hi, everyone. My name is Jessica Ayers, and I'm currently a second year administrative fellow with the Duke Health Integrated Practice.
We're so happy to have you on, not just because you're from North Carolina, although that's a big plus, but also because you're coming from Duke. I know a lot of people have heard about Duke and they're excited to learn what that fellowship is like. We just interviewed someone from Mayo Clinic that's going to be going live yesterday. And so, really excited to have someone from Duke as well coming on. These are popular institutions. I want to go back, though, and talk about where you got your start back in Tennessee. I actually have a friend whose son is actually at that university now for his undergraduate degree, seems to be enjoying it. Why did you go to University of Tennessee? Are you from that area? What was that process like for you?
Sure. So I'm originally from Memphis, Tennessee. And as a naive high schooler, I wanted to get away from home, but not too far. I wanted to be close enough where I could go back home for Sunday dinner, but still have the space I needed to become my own person. And the first time I visited the University of Tennessee, I felt this spark. It felt like home, felt like a home away from home. And I just knew it was the place for me. And initially, when I thought about the major that I wanted to pursue, I wanted to pursue chemistry
Mm.
in hopes to pursue a career in the medical field, actually. And after attending a summer camp for STEM majors the summer before my freshman year, quickly realized that the medical field was not for me. So I changed my major before classes started to business. And I knew that Haslam College of Business would cultivate me and mold me into a young professional, an ambitious individual as I was learning who I was aside from my parents. And that's why I chose UT.
How far is that Knoxville area from Memphis?
It's 6 hours away.
Yeah.
Yeah,
I moved to Charlotte, North Carolina, when I moved out, and that was about 2.5 hours.
yeah,
So a little bit
yeah,
closer than that, but
yeah.
that's wonderful. And so you went through the business program, you kind of switched, early, which is great. So you didn't have to have any,
Right.
wasted credits. In chemistry is a really tough one. I know a lot of the fellows I've talked to, they were pre-meds. They get to Chem 1 and they say, "Oh, I'm
Yeah,
not a pre-med anymore."
yeah.
So
It's tough.
yeah. So after you get your degree, you decide to get an MHA program. And is that because you still had that interest in healthcare?
Yeah, so during the junior year of my undergraduate degree, I interned at a small health system in East Tennessee called Covenant Health. And that was the first time I was really exposed to the business side of healthcare. And that's kind of where that initial ignition came from. And it was then that I decided to explore MBA versus MHA. And I always knew that I wanted to attend UNC. For whatever reason, North Carolina just was speaking to me as a place for my next step in life. And so I did a lot of soul searching, if you want to call it that, to decipher whether or not I wanted to pursue an MBA versus an MHA. And I was wonderfully connected to a mentor named Jeffrey Sims, who I'm pretty sure a lot of people know who that is. And he talked to me a lot about what the MHA program was about and the community that was there, the family that the Gillings community provides. And so I ultimately decided on an MHA.
How did you get connected with Jeffrey?
I think one person knows another person, and then you you kind of get connected through a network of individuals. And I know 5 years isn't a long time, but it is in terms of
So
memory.
early on, you had that networking then that was going on.
Yes,
When did you really start doing that and expanding your network? How early on?
I think it was the fall of my senior year. that I did that because I ended up doing an internship through the Tennessee Hospital Association, and I ended up being placed at an HCA hospital called Park Ridge Medical Center in Chattanooga. And my mentors there continue to cultivate my professional development, my personal development, and really helped me to define the direction of my career.
Nice. So those internships, that networking.
Mm-hmm.
One of the things I want to ask, of course, in North Carolina, you can't go wrong. You have Duke's MBA, you have UNC's MHA, both are in the top 10 there. How many MHA programs did you end up applying to?
I applied to two, actually. I was very confident in what I wanted to do and
Wow,
my
that's impressive.
capabilities. And the two programs were UNC and UAB. And knowing that
Okay.
obviously two very competitive programs. And I told myself that if I didn't get into either of those, then I would expand and apply to other programs who had later deadlines for applications. But I actually got accepted into both. And so I had a very tough decision
Wow.
to make. And ultimately I decided on UNC because of the communal aspect. That same feeling that I said that I felt at UT the first time I visited, I had that same exact feeling at UNC when I first visited. And so I knew from there that it was a no brainer about where I felt I would fit in and where I would thrive.
That's one thing I've actually, you're not the only student who's had both of those schools as their top choices. They are both the best programs. They
Yes,
are very different communities.
yes,
And what's
yes,
so interesting is they're equally amazing in their own way. And that's what I love
absolutely.
is it gives you that choice. And so did UNC live up to that expectation, in your 2 years that you spent
Yeah.
there?
Yeah, it absolutely did. I felt challenged in all the right ways. I felt like I got exposed to those areas of business or the business of healthcare that I had not gained exposure in through the internships that I'd had prior to starting my MHA program. And then also, my cohort was nicknamed the COVID cohort because we began courses in the fall of 2020. And so, obviously, all of our classes that first year were online, we were remote. And so, it was very hard to foster that friendship with all of my classmates, and yet we did. I think we were all very intentional and very persistent with building those relationships with each other.
And so probably Pujan Karnik.
I do.
Okay, so you know all of them. I've spoken with most of the. It seems like I'm speaking with most of the same class right now. Uh,
Poojan is actually in the cohort behind me, but I
okay,
did have some great experiences with Poojan during my second year and her first year.
wow. How about Ravi?
No, Ravi. No.
Okay, I think she went to a different program, but I know she knows most of the fellows. Did you take in any of these UNC basketball games? While you were there?
Unfortunately, no. I am not a fan of large crowds or events, large scale events that bring a whole lot of people together. And even during undergrad, I didn't go to a whole lot of UT football games. I know, SEC football games are a really big thing. So it's not my jam, but I did explore Franklin Street and got to experience, what the life was like as a UNC student for sure.
Of course. So you stayed within your comfort zone, didn't
Yes.
do anything too crazy, but you still got that experience. So
Yeah.
that's wonderful.
Yeah.
And then what's interesting too is you did have that internship experience at UAB.
Yep.
So what was that? That must have been a great experience since that
Yeah.
was one of the areas you had gotten into and
Yeah.
interviewed for the MHA program.
Yeah, it was a very full circle moment. When I was applying for internships, I think I was very intentional with where I applied. I wanted to have some regional diversity or continue adding some regional diversity to my resume and to my experience. Having started out in Tennessee and then getting my education in North Carolina, I felt, rounding out my Southeastern repertoire was the way to go with going to Birmingham, Alabama. So definitely another challenge. Definitely, I mean, a large academic institution like UAB was. And it definitely helped me realize that I did not want to pursue a large inpatient hospital, which is why I pursued an ambulatory experience for
Mm.
my fellowship. But it was great. I was challenged in a number of ways, and I really appreciated being able to build on my inpatient experience.
What made you realize that this wasn't something that you wanted to do in terms of large and inpatient facilities?
the ways that I was stretched in so many ways. Albeit I do appreciate being able to have all of the exposure that I did have to the different areas of a hospital. I never really felt like I got to dive into one specific area and really thrive in that area. I felt like it was all very surface level, and I craved more from a service line, or I craved more from an arm of business. And I thought that with the way that the healthcare industry is trending now, with trying to keep people out of the hospital, I thought that pursuing an ambulatory focused fellowship would give me more of that in-depth experience in an area of the industry that is exploding right now.
Absolutely. It's a huge contrast in terms of what the administrators have to deal with and what they
Right,
can focus on.
right.
What hospital were you at with UAB? Was it
The main hospital,
the
the
very
big
large
one.
one? That one is because I know Morgan Gagan of
Mhm.
Highland. Are you familiar with her?
She was actually the fellow at the time who oversaw me and my co-interns. So
Oh, that is great.
very,
Oh
very
my
fond
goodness.
of Morgan.
Yeah, so am I. Wonderful. This is so great that we have these connections.
Yeah.
So it is a huge contrast because she, now runs Highlands,
Hmm.
and in talking to her, she likes the expansiveness, the many hats aspect of it. And then some of our other fellows like yourself, you want to be able to focus on that one thing. And so that's nice that helped you weed that
Yeah.
out. So then you applied for those 7 fellowships that you mentioned earlier, which
Hmm.
isn't as many as some fellows have applied for. It's 7 is a pretty good number. Like you said, you wanted
Yeah.
to stay in the triangle area. And then you got into to Duke's. You probably actually got into a few, right?
Hmm.
So why did you choose Duke specifically?
It was a no-brainer, honestly. That comfortability that I've mentioned before, that's a really big priority for me in terms of what I'm looking for in a next step, is how I feel. That I feel like I'm looking for this synergistic alignment, so to speak. Do I feel like the people that I'm communicating with in this area bring out the best in me? Do I feel guarded? Do I feel like I have to withhold parts of who I am? Do I get the vibe that they're going to invest in me and nurture me and appreciate what I bring to the table and what I don't, And I felt that wholeheartedly in that final round interview but it was just that it was a feeling. It was a feeling.
Nice. It's wonderful when you find somewhere that you really feel at home with
Yeah.
and that it's the right decision.
Yeah.
What has the fellowship been like in terms of the layout of those 2 years? Where have you been working? What projects have you been working on?
Yeah, so the first year, the entirety of the first year is all rotations. During the summer and fall, you are focused within the ambulatory space. So you are rotating with the different functions of business, the different leaders there, and you get to hang out with some clinic leaders as well. So a lot of traveling all over the triangle area, obviously, because we're ambulatory. So we have different clinic sites, and those clinic sites are chosen for you based on your areas of interest. And for me, that was women's health. And I was also able to hang out with some pediatric clinics as well. And also cardiology, because I have experience with cardiology service lines in the past. So that was really cool to see all of those areas from an ambulatory perspective. And then in the spring, we broaden our horizons by rotating through the health system side. It's not a side anymore, but the health system, the larger health system. So the 3 hospital locations, the main hospital, regional, as well as the Raleigh hospital. And we rotate with the leaders at each of those locations. I really appreciated that. Again, getting that very broad exposure to how Duke does care, and being able to identify where I feel like my niche might be in the broader health system. And then in the second year, you are to choose an area of focus. And
Mm.
that's exactly what it sounds like, an area in the health system, within the larger health system, that you want to focus your time and your efforts as a fellow for your project work. I chose strategic planning and women's health. I came into the fellowship guns blazing for operations. I was very sure that I was going to be an operations leader, but again, after those initial rotations, I quickly realized that's not really the life that I wanted to live. It wasn't where my skills and my talents really flourished. So through additional rotations, I thought that strategy, business development was better for me. And my time with strategic planning and with our women's health leaders has been phenomenal, and definitely grateful for this second year and how I have watched myself grow.
Wow. So that's an incredible fellowship program, it sounds like, because you've actually been able to really narrow down. And then after you've narrowed it down, you're able to get even more experience. So you're going to be
Exactly.
very well prepared to lead.
Exactly.
I want to ask, what is women's health from the Duke perspective? Up in some other areas of the Northeast, that might just be OBGYN or something else. So what is the Duke version of women's health?
The leadership within our OBGYN department, as it currently stands, is doing some really great work to broaden what women's health means, including gynecology and all other aspects of women's health. So, not just OBGYN, but everything from routine mammograms and well woman visits within the primary care space. We are really trying to ensure that in terms of branding, it is a all encompassing women's health brand, and that is how we're offering our care. We're ensuring that we're breaking down those silos and breaking down the walls from the different subspecialties within women's health, but making sure that no matter what ailment a woman is coming into, trusting us, to care for them with, we are ensure that we are caring for that person in every aspect.
Is Duke doing with access, especially to some of these essential screenings that other large health systems have really struggled with? Is it still a struggle, or is this new approach where you're able to have all encompassing women's health? Is it providing more access, especially to the most needy? What does that look like in that area?
Yeah, access in general is a struggle for us, as I think it is for everybody. But I'm actually a part of this system wide project where we are working on expanding contraceptive care for women as well as for men through vasectomy procedures. And I know that's one small sliver of what women's health is, but I feel really proud and honored and grateful to be a part of this work to tackle the limitations that we have somehow put on ourselves as healthcare institutions to expand how we meet the needs of our patients. And I've been very intentional about how I use my seat at the table to ensure that we are tackling this problem from varying perspectives. And like you said, from those who are most in need, you don't know the type of patients that are out there because that's not your situation, right? And so thinking about young teens and, they might be afraid to talk about contraceptive care in front of their parents. Well, how do we have that conversation still? How do we ensure that they're getting what they need so that we can prevent health issues later down the road for those teens or whomever else, or when we think about women who have pre-existing conditions, how does contraceptive care affect their underlying conditions? And then for men who are open to the conversation about having a vasectomy, how do we ensure that they are getting the appropriate counseling so that they can make the best decision for them and for their family? So it's a lot to tackle, but I'm definitely honored to be a part of this work.
So there's so many layers to even
Yeah.
these simple issues. I remember I was doing a work, I created a PAP toolkit for our outreach coordinators to help women get their PAP smears completed. And one crazy thing that I learned at a health conference, which, as a man, never even thought of it, was that
Yeah.
in sex ed,
Yeah.
women aren't taught anything about PAP smears.
Yeah.
And so they turn 18,
And
they're on their own, they're out of school, and then all of a sudden they're 21. It's like, whoa, I got to do what now? This does
yeah.
not sound
Yep.
good. And
Yep.
it's a terrifying experience. I know, I
Absolutely.
talked to my wife about it now, and she's like,
Mhm.
"Oh yeah, you have no idea what's going on
Yeah.
because they never even taught you about it in
Yeah.
school." And so it's an incredible work that you're doing. I'm very passionate about that as well. It seems like you feel very fulfilled in what you're doing.
Absolutely. Very
That's
much
really
so.
nice.
And I think I was very intentional about all that soul searching that is required as an early careerist. And maybe it's born out of fear as well for being stuck in a job that I hate, but definitely try to make some intentional decisions very early on so that I could have these types of conversations and ensure that it was evident that I love what I do and I feel like I am having an impact on patients' lives beyond the four walls of a clinic, beyond the four walls of a hospital. I want my career to be evidence of improving the lives of patients from a holistic perspective.
I'm sure, of course, myself, but a lot of our listeners want to be in that position that you are in now. We want to be successful and happy about our careers. What is any advice? Of course, intentionality is probably the number one piece of
Yeah.
advice that you've given us so far. But is there anything else that you would recommend to us so that we can be as successful as you've been?
Oh, well, thank you for thinking that I'm a success. I feel like I'm still working on it, but I won't deny the or acknowledge the accomplishments I've created for myself thus far. But something that I did for myself very early on was create a mantra, something that I could revisit in times of doubt and when that imposter syndrome creeps up on all of it. And my mantra during grad school and through the fellowship interview process and all of that has been that I am undeniable.
Mm.
I'm not just competitive, right? Because all of my peers, all of my classmates who are in fellowships right now or who are seeking out fellowships, we all go through MHA or MBA programs. We all have these wonderful internship experiences. We're all competitive candidates and we all have these great skills and talents that we can bring to the table to improve wherever it is that we land. So that's great. I appreciate that I can see myself as competitive, but that doesn't set me apart from the next person, right? I'm undeniable. When you
Mm.
see my resume, when you shake my hand, when you meet me after a conversation, I'm undeniable. There, you can't deny the charisma or the aptitude or whatever it is that you perceive about me. You can't deny that.
Mm.
And because I, again, like you said, I'm very intentional about how I present myself, how I tell my story, and the work that I do. I'm very intentional about all of that. And so I think that helps in terms of my confidence in how I present, and it makes a difference in how I show up to work meetings and the work that I complete and all of those things. It really does go back to confidence and having that mantra, whatever yours may end up being. It helps you stay grounded in who you are and what you're capable of, despite all of the noise that you might be experiencing around you.
Wonderful advice, Jessica. Thank you so much for joining us during your lunch hour today.
My
I couldn't
pleasure.
be more appreciative, and hopefully, we can have you back on once you probably settle into your leadership role after your
Yes.
fellowship.
Yes, definitely.